This week is National Suicide Prevention Week, an annual campaign that aims to engage and inform the public about suicide prevention and warning signs of suicide. In Lewis County, there's a sort of quick response team that jumps into action when someone dies by suicide to provide support and to try to prevent the next death. The Lewis County Traumatic Loss Team on today's Story of the Day.
Support for Story of the Day comes from Kenny Drugs, now offering a new mobile app to help patients better manage prescriptions for themselves and their family. More at kennydrugs.com. And Clarkson University, offering over 95 programs of study with campuses in the Hudson Valley, Central, and Northern New York. More at clarkson.edu.
Hey, I'm David Sommerstein. It's Friday, September 15th. First up, the national child poverty rate has more than doubled in the past year, according to new data released by the Census Bureau this week. The rate has jumped to 12% nationally and 18% in New York State, but it's even higher in much of the North Country. Lucy Grindon reports.
According to the latest census data, Franklin County has the highest child poverty rate in the North Country at 27%. Ellie Gent works for the Joint Council for Economic Opportunity, or JCEO, of Clinton and Franklin counties. It's a nonprofit organization that helps low-income people by offering things like food pantries, weatherization assistance, and counseling on how to find childcare and transportation. Back in March, when the extra pandemic-era emergency allotments to the SNAP program ended, JCEO saw more clients visiting their outreach centers and food pantries.
We saw numbers very close to double pretty rapidly as people stopped having that extra cushion to help them afford, just basic necessities.
Gent says families with children have been especially susceptible to slipping back into poverty.
The more children you see in a household, the higher the chances of the poverty. It kind of correlates.
Experts have also said the child poverty increase is due to the end of the enhanced child tax credits, which gave households up to $300 a month for each child during the pandemic. That program stopped at the end of 2021. So far, JCEO has been able to meet demand at its food pantries, but Gent says it's costing them a lot.
We are a little nervous looking forward. The cost right now for operating pantries in both counties, and we have, more than 10 community outreach centers in both counties. It's costing about $6,000 a month, and that is including the fact that we're able to glean a lot of food from places like Walmart and Hannaford and Price Chopper.
After Franklin County, St. Lawrence County has the second highest child poverty rate in the North Country at 26%. The rate is also higher than the state's 18% average in Lewis and Herkimer counties. Lucy Grindon, North Country Public Radio.
Crowds will flock to Lowville tomorrow for the annual Cream Cheese Festival. The Kraft Heinz facility in the Village in Lewis County is the largest cream cheese plant in the nation. It produces Philadelphia brand cream cheese. There'll be live music, plenty of food, and even a cream cheese recipe contest. All recipes must feature cream cheese, of course, and will be judged on taste, creativity, and presentation. The festival's main attraction? A giant cheesecake. The story you're about to hear will discuss suicide. If you prefer not to hear it, turn down your radio for about 5 minutes. So, Lewis County has the highest mortality rate for death by suicide in New York this year, almost 3 times the state average. A team of volunteers has grown up over the last 5 years in the county to help families and friends cope and to try to prevent the next tragic loss. Amy Feiereisel reports.
When just one person dies by suicide, there are big ripple effects.
The number of lost survivors someone leaves behind can be really vast.
That's Anna Platts, the Deputy Public Health Director in Lewis County, which has a population of about 25,000 people and the highest suicide mortality rate in New York. Platts says it's hard to speculate about why the suicide mortality rate is so high in Lewis County. With such a small population, the difference of a few deaths can swing them from below average to the worst in the state. But national studies have found that older people, men, and military personnel are all at a higher risk for death by suicide. In Lewis County, there are about 4 to 8 of these deaths per year. Platt says that's not a small number.
We may have 4 to 6 or 8 suicide deaths per year, but the people impacted by each of those losses is really significant.
Studies estimate that at least 100 people are impacted by a single death by suicide.
It can really rock a community, especially a small community.
Platt says suicide prevention is a top priority for the county health department. Like most, it has a crisis line and a suite of suicide prevention programs. But it also has something less common, a postvention program. It's called the Lewis County Traumatic Loss Team. It's been around since 2018. Platts is the team's coordinator. She says postvention is about immediately supporting suicide loss survivors, like family, friends, and coworkers.
To really help them find some stable ground and ultimately reduce the risk of contagion after that loss.
According to the National Institute of Mental Health, one of the highest risk factors for death by suicide is being exposed to suicide. That's what Platts means by contagion.
There's a certain amount of vulnerability to those individuals after the death has occurred.
The Lewis County Traumatic Loss Team helps people process their grief. About a dozen trained volunteers respond to deaths by suicide, but also drug overdoses and automobile crashes. Anyone can request their help after a loss. Their support can look like a lot of things. One method is debriefing circles, which all volunteers are trained how to facilitate.
It's a series of questions. We literally sit in a circle with the loss survivors and talk through how this loss is showing up in their lives.
Platt says it can also look like a shoulder to cry on, someone to talk to, giving survivors resources. Originally, the team's goal was to meet with loss survivors 1 to 3 days after a death. But in January, the team started offering an active response. That means they go directly to the scene of a death, often to a home.
It's, helping people figure out, okay, these are the steps that need to be taken.
Carla Hellinger is one of the team's volunteers. She says the active response allows them to be there when people are feeling most helpless and confused.
And it might be something simple like, we need to get you out of this house for tonight. Let me help you pack a bag so that we can do that. And then, these are the people that maybe immediately we need to contact. Let's get in touch with the school.
Hellinger says that also takes emotional work off the plates of people like the police and the coroner.
They have, tasks that they need to complete. So I think our presence has been helpful.
Hellinger works for the Lewis County Office for the Aging. The other trained volunteers include social workers, law enforcement, and educators, like Becky Tiffany. She works at Loudville Central School as a middle school counselor.
Just a wide range of support. And so when we get a call, we try to figure out, who's got a little bit of maybe familiarity with the situation or the family or the whatever it may be to kind of help us navigate.
For each death they respond to, between 6 and 10 each year, the traumatic loss team might work with a couple to a couple dozen people. They also often support first responders and healthcare professionals who are involved. Tiffany says it's important work and personal.
Why do I do it? I grew up in this community. I'm a pretty big part of the school system. I know a lot of the families.
She says it helps her to know the team exists and to be part of it.
At least it's that connection to know that somebody is looking out for them.
Anna Platts, the team coordinator, says it's hard work, but it's also affirming.
For me, it honestly started as part of my job, but I did not expect to love it. I mean, I get nervous before every activation or debriefing or every time my phone rings, but I am constantly in awe of the resilience of our community and their strengths and their resourcefulness and how we all come together during these tough moments.
She says they all hope that their work means there are less of those tough moments in Lewis County. Amy Feiereisel, North Country Public Radio.
If you or someone you know is having thoughts about suicide, call the National Suicide Hotline. It's 988. And if you're interested in volunteering for the Lewis County Traumatic Loss Team, fill out the volunteer application. You can find a link to that in our online story at ncpr.org. We have more news there all the time and through the weekend, ncpr.org. Music today by Eddie Lawrence of Moira and December Wind of Akwesasne. Have a great weekend. I'm David Summerstein, North Country Public Radio.